Another type of blood-formed element is the white blood cells. These circulate part of their lifespan within the bloodstream and then take up residence in various tissues. Their lifespans can be from days to decades. Their functions are to migrate into tissues where they take up the job of maintaining the health of those tissues, detecting and getting rid of pathogens, cellular debris, and so on. They have a kind of an amoeboid movement, meaning that they just kind of ooze along. The front side oozes out and the back side just kind of follows along as necessary. They exhibit positive chemotaxis. They are attracted to specific chemicals. Many of them are phagocytes, engulfing and destroying the pathogen cellular debris and so on. Looking at the various types of leukocytes, which are white blood cells, let's begin with what we call the granulocytes. Granulocytes have a very granular cytoplasm. It's very visible. You get over here to the monocyte and it is not as visible. Now you're looking at an agranulocyte. In the granulocytes, we have the neutrophils first. About 50 to 70% of the circulating white blood cells are neutrophils. These are basically your injury cells because they are the first to arrive at a site of injury, where they will phagocytize any labeled pathogens. How do they get labeled? Typically with antibodies bonded to antigens on the cell surface. They're attracted to those antibodies. Typically they exist in the bloodstream about 10 hours, but they have a lifespan of 30 minutes when they are actively phagocytizing debris. Second type are the eosinophils. Eosinophils are named because of the red eosin dye that they take up. 2 to 4% of the circulating white blood cells are eosinophils, and these are active against parasites. Big parasites, small parasites, doesn't matter. If they're a small enough parasite or a labeled cell of another kind, the eosinophil can phagocytize it. But if it's a really large parasite, it will produce cytotoxic chemicals. Cytocell toxic, it's going to kill them. Cytotoxic chemicals that then will destroy those large parasites. These cells typically are increased in number during an allergic reaction as well. Third type is the basophil. Basophils are smaller in size than either the eosinophil or the neutrophil. They produce histamine. Now they're going to arrive at an injury site as well, where they produce their histamine. The histamine dilates the blood vessels. They also produce heparin, which reduces blood clotting. The combination of those two are going to enhance inflammation. The swelling, the fluids accumulating in the tissue is the result of the dilated blood vessels. Also a change in permeability there. Now looking at the agranulocytes, we have the monocytes. About 2 to 8% of your circulating white blood cells are monocytes, and they are a very aggressive phagocyte. They exist about 24 hours in circulation, and then they move to the tissues where they change their name to a macrophage. As a macrophage, when encountering pathogens and cellular debris, they release chemicals that then are going to attract neutrophils, other monocytes, as well as other cells like fibroblasts, which are going to begin the healing process by producing collagen fibers. Lastly, we have the lymphocytes. Lymphocytes are part of your specific immune system. This means that they work with very specific, unique pathogens. The other four that we have talked about so far are part of the non-specific immune system, acting against any and all pathogens. Lymphocytes are about 20 to 40% of your circulating white blood cells, and then they take up residence in lymphatic tissues like lymph nodes, the spleen, and the thymus. We have three different types of cells in the lymphocyte category. The first one are T cells. T cells typically reside in the thymus or finish their maturation in the thymus. They are involved in what we call cell-mediated immunity. This means that they are going to directly attack and kill pathogens or infected cells. We call them cytotoxic. These are also the cells that are active during transplant rejection. The B cells are involved in humoral immunity. Now, humoral refers to anything to do with body fluids, in this case, the blood. They produce the antibodies that are going to be transported in the blood. The third type of cells are NK cells, or natural killer cells. They destroy abnormal and infected cells. They carry out an immune surveillance, looking for those abnormal and infected cells, and as such, they prevent cancer. Leukapheresis is the process of producing new white blood cells. As we have talked about in other formed elements, they begin as a hemocytoblast. Then they are stimulated by these colony-stimulating factors that differentiate the cells into myeloid stem cells, and then on down to the different types of cells. Now, the lymphocytes take a slightly different path. They come down the lymphoid stem cell side here and become the lymphocyte. Colony-stimulating factors are a chemical that work with the cells. You notice here we have the multi, and the multi-colony stimulating factor is differentiating this myeloid stem cell into red blood cells, its platelets, or white blood cells. So it has a multiple function. The GM CSF is granular and monocyte. M is the monocyte stimulating factor, and G is the granulocyte stimulating factor.